Welcome to the webinar. Today we're talking about building a first aid kit, and I know I'm super interested in this. I don't have a first aid kit yet for my pets, and there's been a lot of natural disasters going on that I've seen, and I feel like this is such a good topic, especially this time of year. We got hurricane season coming and spring and summer, so it's natural for pets to, be running around outside and get a minor injury or something that you just need on hand before taking them to the vet's office. So I am good to go. Dr. Emily Goff is here to basically teach us why it's important to have one and how to build one for ourselves. So I'm going to go ahead and let her take it away. If you have questions, like I said, drop them in the chat and we will get to them.
Great. Good afternoon, everyone. Thanks for having me back at the clubhouse. I'm excited to be here. Let me just pull up my screen and make sure I've got it shared correctly. Okay. Erica, can you confirm you see the PowerPoint and not the notes part? Okay. All right. So today we're going to talk about first aid kits for your dogs and cats. So very excited to go through this with you all. This is a lot of what we do at AskVet every day is help pet owners really feel empowered to know what is normal with your pet, when you're supposed to get checked out, when you can sit on something, and what to do in the meantime. So your first aid kit is sort of the start of that. So you have things on hand as we are giving you recommendations of stuff to do at home. You can just go grab your kit and follow through with those recommendations right away. To get started, how many of you already have a first aid kit? You can either put that in the chat. There's also a way, I believe, with the Zoom, you can hold up your hand and sort of raise your hand with one of those little emoticons to say if you have one or not. If you don't have one, that's okay. This is where we're going to get started. If you already have one, great. Hopefully you'll take away some tips on what you can do to modify, or at least maybe how to use the things in your kit, which is the most important part of having those. So this is my kit, which is from my kids and my pets and myself and everybody in the family, which is not what we want. My husband likes to joke that I am preparing for the zombie apocalypse because I refuse to throw away meds, which, you should throw things away, especially those antibiotics that you should have finished. But I know all you pet owners keep them and not finish them at times. But I do encourage you to keep things that this is not the way to do it. So the goal is to have the things that you need, but also know what to do with them. And then this is another great one. I have several of these as well, which, it's great to be prepared, but do you really use things in these kits? No, they're beautiful. Maybe I break out a Band-Aid on occasion, or I go steal the scissors for something else and then forget to put them back. But that's really often, sadly, what comes of these nice prepared kits that you can get at the store, or even for your pets. They have those as well. So our goal today is to really make one that's customized to your pet. So we want you to have a kit for each of your pets individually versus an all-encompassing pet first aid kit, because these are going to be things specific to your animal that you can just grab and use right away. So one of the things that you want to have first is an emergency information sheet, which Erica is going to post after this in the clubhouse. So you're welcome to download ours, put your own information in there, or you can make your own sheet. You want to include things like your veterinarian's contact information, poison control, a local emergency clinic that's in your area, especially if you're planning on using this kit. If you have a pet sitter, maybe an unexpected event, somebody needs to come get your pet, take them to their home, they can just grab this kit at the same time, and they already have listed out things that's specific to your animal. Go ahead and keep down their weight and take your pet's vitals, which we'll talk through in a minute how to do that. Because if you don't know what's normal for your pet, it's hard to know when it's abnormal. And then a list of medications that your pet is taking. But also, I really encourage everyone, next time you're at the vet with your pet, go ahead and ask your veterinarian, what can I use that's over the counter for my animal that's safe? What dose is that? What frequency can I give it at? When do I use it? So, what if my pet gets stung by a bee? How much Benadryl can I give? How often can I give that? When do I use that versus when do I need to do something further? And that's what AskVet is here for as well. So if you have those questions, something comes up with your pet, you can jump on and chat with a veterinarian to get more advice on what needs to happen with them. But if you already have that dose from your veterinarian, then at least we can tell you to go ahead and administer that. So getting a list of things, already mentioned antihistamines, antacids are often safe to give over the counter with your veterinarian's permission. So go ahead and ask them about those types of things. What to do for diarrhea, all those things that you want to ask ahead of time, you can put that on your information sheet. A photo of your pet, just in case they get lost. It's nice to have those. This day and age, we have a million photos on our cell phones, so probably not as necessary as maybe it used to be in the day, but something nice to have with your kit. So I'm not going to go through everything on this list because we're going to go through it one by one, but these are the things that we're going to kind of go through. So your basic assessment, having a thermometer in your kit is important. I highly recommend just the standard, $3 digital thermometer you can get at CVS or Walgreens. It's going to be most effective if you do that rectally. So having gloves and lubrication in your kit is also important if you feel like you can do this safely. And sometimes we feel like, oh yeah, my pet will allow me to do a rectal temperature. But when they're in pain, they're uncomfortable, they may not allow that at the time. So they do make thermometers for animals that you can do with the forehead or the inner ear thermometers. And while they're not always as accurate, that's a nice thing to have on hand if you'd rather go that route instead of the rectal thermometer. Just a tip though, if you choose the digital thermometer, not able to take that rectally, you can just shove that up in the armpit area real high up, and then kind of add 1.5 degrees to 2 degrees from what you get from the armpit reading. You'll be relatively in the realm of what you're wanting to see for your animal. Normal for dogs and cats is going to be in the range of 100 to 103. Now, if they're stressed, they're in pain, that temperature can go up. Doesn't always mean a fever. When I see animals in the clinic, sometimes they're at 103.5, 104. And if they're super anxious, they had a bad car ride or something, I'm not going to always call that a fever because it may go down if I recheck it in about 20 minutes and then it's going to be back into normal. Same thing on the opposite side. Sometimes you can get something closer to 99, even 98 if there's a lot of stool in the rectum, if that's the way you're taking the thermometer reading. So just keep in mind there can be a little variation that you may need to retake it a few times just to verify that that's actually accurate. A watch with a second hand. One thing, it's nice that you can get a respiratory rate or a heart rate. In the event of something such as a seizure, one of the most important things we want to know about is how long did that last? So timing those types of episodes, or any abnormal episode you're wondering about, just knowing how long did it last. Sometimes that can help us deduce out what potentially happened or what was the cause. A seizure, for example, is not going to last more than usually 2 minutes. If it's going beyond 2 minutes, we know that's more of an emergency. So having a watch with a second hand can come in really handy. So the respiratory rate, a few things with that. We check our pet's respiratory rate when they are awake, not when they're sleeping, because they tend to do a lot of funny things when they're sleeping. They can have some rapid breathing with some slow breathing. They can snort, they can dream, they can twitch their eyes. And as long as they're asleep, it's not usually a concern. So when they're awake, they're alert, but they've been resting next to you for at least 5 minutes, just kind of relaxing. That's the time you want to check their respiratory rate. We don't want them to be panting. If they're panting, that's not what we count. Panting can be a sign of pain. It can be a sign of anxiety. So you want to wait until your pet settles down a little bit. We have closed mouth breathing. That's when you want to take your reading to see how many breaths are in a minute. Similar with heart rate, we want them to be awake. We want them to be relaxed. Heart rate, you can take a couple of ways, either by placing your hand on their chest, just behind the point of the elbow where it meets the chest. Or another way is just taking a few fingers on the inside of their thigh. You can feel the femoral artery beating in there to get a heart rate. So know your pet's normal. That way, if something were to happen, you can kind of know if something is elevated or not. And then just a quick note about reverse sneezing. Many people have probably heard about reverse sneezing, but it is a little bit scary and alarming if you haven't seen, especially dogs do this more often, where they're going to do sort of that snorting sneeze. I have a little video and I'm not sure if the sound's going to show up, but you can also Google reverse sneeze at any point in time on your computer so you can see it yourself. It looks scary, it sounds scary, it's loud. But reverse sneezing is just a reflex that dogs will do when they have some irritation in the back of their throat. So we get a lot of clients chiming in through the app that their pet's in respiratory distress. And by getting a video of that, we can really help them discern between respiratory distress or is this reverse sneezing or something else that we need to discuss. So videotaping some of these episodes is also really nice. With reverse sneezing, if your pet's doing that, you can sometimes temporarily resolve that reflex by getting them to swallow. So even just sort of opening, closing their mouth a few times to get them to kind of move their tongue and swallow can get them to clear that irritation. And it may start back up, but it's very rarely going to be an emergency situation. Okay. Some other items. The cone of shame, the e-collar that nobody wants to put on their pets because we all know it's frustrating and we hate it. But they come in so handy with first aid. So having one that's already fit to your pet and handy that you can go grab is really nice. For one thing, the cone is really the most effective e-collar out there at preventing any licking or chewing on wounds or skin irritation, broken nails, that kind of stuff, until you can get that addressed with your veterinarian. We don't want them damaging themselves more than they, potentially already have. The inflatable cones will allow that in the kit. If you want to do one of those inflatable neck ones, just keep in mind if you have a dog with a really long nose and the injury is more at the tail or the feet or lower extremity, sometimes more often than not, they can still get around those inflatables. Even just having a t-shirt, to cover up a wound area so they can't chew at it is a good option. Another thing to keep in mind is just taking a large towel, rolling it in sort of a long fashion, wrapping that around the neck can be a temporary way to use for an e-collar, because it's also a nice way to keep a dog that maybe is painful or uncomfortable from biting. If you need to transport them, lift them into a car to get them where they need to go for more help, we don't want them turning and nipping at you or anybody that's trying to assist you. So putting that cone on during those situations or wrapping that towel around the neck so you have some more protection. Same reason to maybe have a muzzle. These basket muzzles are nice because pets can still pant and open their mouth if they're having a hard time, they're in pain, maybe they're panting a lot more, they can still breathe very easily through the basket muzzle, but it gives you some protection if you need to transport them and they're injured. Gauze rolls can also be doubled up as a muzzle. So maybe you want a gauze roll already in your kit, but you can also just gently wrap that around the nose and around the back of the head as a very temporary use for a muzzle if you need to do something that maybe will cause some pain to them. A slip leash carrier, those are great to have, especially if you want to use your first aid kit to double up as your evacuation kit. If you live in a place with flooding or, you worry about hurricanes or something like that, keeping these things in the same area. Your carrier can also sort of be doubled up as your holder for all your first aid items. So you can shove that in the carrier and then you have it all together. And then just an example of a slip leash. All right, so wound care, I want to impress upon everybody that mild soap and water is really all you need and effective for cleansing wounds. This is especially true for superficial wounds. There's wounds that are more of puncture or maybe dog bites that we don't really know how deep those can go, especially if they're on the thorax or on the abdomen. Sometimes those can actually enter the chest or enter the belly. And we don't want to be putting water and soap or other products on those wounds because obviously we don't want that to go internal. But for superficial abrasions or cuts and scrapes, cleansing that skin with just mild soap and water can go a long way, just like us, washing our hands. Dawn dish soap is known a lot for mechanical removal of things. So if your pet were to roll in something toxic, blue-green algae is a big one. If you live more in sort of the northern United States near the lakes and stuff. If you have a dog that likes to go swimming in lakes, if they have contact with blue-green algae, bathe them really well, get that off before they were to ingest anything. So Dawn soap can be useful for that. It can be useful for tar, grease, chewing gum in the fur, all those things that you want to get out of the hair. Having that on hand is really helpful. Of course, washcloths and rags for cleaning. Eye wash, So if you want to rinse the eyes out for maybe you're bathing your pet, you get some shampoo in there accidentally, or you're worried something blew in the eye, they're doing some squinting, just have some eye wash on hand. This is a good brand because it's basically purified water. It's meant for flushing. There's a lot of things out there you'll see for lubrication or dry eye or even contact lens solution. And while those aren't necessarily harmful, they're not meant for what you're wanting, which is flushing. So just having some basic eye flush on hand is nice. If you're doing the flushing, just like we learn about ourselves for first aid, we have those eye wash stations for us. You want to liberally flush across the eye, try to remove anything that's stuck in there. But if your pet continues to squint, hold its eye shut, you see a lot of redness or any swelling or haziness to the eye, more rinsing is probably not going to help that situation. There's probably actually some trauma to the eye or something else that's causing pain that needs to be addressed. But, just doing one rinsing to try to see if that'll clear the problem is usually pretty safe. Same with ear wash, having some cotton balls in ear wash. If there's some irritation with the ear, maybe your pet's prone to allergies and itchy ears, being able to flush those ears out routinely is nice. If you're getting a lot of debris, pain, redness, then we also worry about infection and probably need to do more than just a general cleansing. Okay, peroxide is a big one. A lot of people like to keep in their kits, but maybe not for the reasons you're thinking of. So skunk recipes, if your pet gets unfortunately sprayed, peroxide can be good one mixed with just soap and baking soda to have sort of a deskunking recipe. It is a very big skin irritant and can be damaging to tissue. So we really don't recommend it be put on wounds. Soap and water, that's what you want to do instead of the peroxide. Vomiting, there's going to be a lot of things that pets get into. I'm constantly surprised at the new things that I see pets eat, and I'm often surprised that it made its way down. So a lot of the things that they eat, we really don't want coming back up. So we never want to induce vomiting unless you've been directed to do so. Things like battery acid, stuff that can be caustic and irritating on the way down. We don't want to burn the esophagus on the way back up or potentially get stuck on the way back up. So make sure you have a professional that's told you it's okay to induce vomiting. Poison control is a good one to call if you're ever curious. Is that something should you do at home? But we only ever do that if the benefits going to outweigh the risk, because peroxide, we know, is going to cause some ulceration of the stomach, which is why we never do it in cats, because we know they just have a very bad reaction to peroxide. So only for dogs and only with your veterinarian's permission. All right, so a few other things for minor wounds you might want to have on hand would be Epsom salts to do some soaks. A quick tip on that, and a lot of pets are not going to let us just put them in the bath or stick their paw in the bucket full of water and just sit there. You could just take the rag, put it in the water with the salts, let it soak in the rag, and then just wrap the rag around the paw, maybe that's swollen or, wherever it may be. You want to use this more for maybe like some irritated paws, like pets with allergies that have some swollen areas between the pads. That kind of stuff would be nice for the Epsom salts. An ice pack, warm compress, same sort of theory where we're trying to reduce swelling, help with pain. So having those ice packs that you can break open in your kit whenever you're ready to use them are good. Just make sure you have a dry towel between the compress and your pet's skin. And if they choose to move away from that, you want to allow that. We don't want to force the issue because they can't really tell us what's comfortable for them or what's stressing them. So you're welcome to try that. But if your pet's not allowing it, it's better to just move on to some other form of first aid. And as far as medications go with wounds and for pain, there really are no safe over-the-counter pain medications for dogs and cats. We know things like Advil are toxic. Tylenol at most doses are going to be toxic as well. So that goes back again to asking your veterinarian in advance, what can I give for pain? Is there anything I can keep on hand? And when can I use those items? So they can give you something that's going to be more effective, especially if you have an older pet, an older dog or something that's more prone to arthritic discomfort. And maybe there's days that we overdo it and we know they're going to be sore, but it's not something that's a daily, problem. You might ask them if there's something that you can just keep, on your first aid kit in case you need it. A quick note about doggy aspirin. I know it's out there. You're going to find it at a lot of the pet stores, but I don't recommend using that really ever. We know aspirin is not an effective way for reducing inflammation and pain in pets, and we do know it can cause ulceration of the stomach, even in very small degrees that we may never know about. It also prevents us as veterinarians from giving something effective after aspirin's been administered. We have to have a washout period for several days between our anti-inflammatory drugs. So if you give a doggy aspirin the night before, come in to see us for the limping, or then a little bit inhibited at giving something right away that's going to be effective for that. So it's better just to rest, as long as your pet is comfortable. Maybe they just started limping, they stumbled on something playing ball or whatever. If they can rest comfortably, they can sleep. They're not up excessively panting. They can't even lay down. If they can sleep and everything seems fine and rest, maybe do a cool compress on that. Then if they're still limping the next day, you can reach out to your veterinarian, but I would avoid giving any medications for that. Okay, sorry, I didn't keep up with my pictures. Okay, so bleeding. Of course, nail tremors and septic powder is going to be something you're going to want to keep on hand. If you cut a nail too short, you have a broken nail on accident, those sometimes can bleed pretty excessively. So they do make just, at pet stores, you can pick up some powder to put on the end of the nail to keep that bleeding in control. If you don't have that, flour, cornstarch are acceptable items to just pack onto that bleeding to try to control that. Any other wounds, though, if there's going to be a dog fight wound or something else happens to your pet where they have a wound on their skin and there's some bleeding, you want to apply pressure to that. Some non-adherent gauze pads or Telfit pads, you can find those at most pharmacies in the first aid section, are nice to put on first. And then you're going to apply your pressure with your towel after that. Because what happens is you get that bleeding under control by applying the pressure, but the minute you remove the towel, you're kind of ripping away that clot that you just formed. So the non-adherent pads being on there first are going to keep that clot already formed a little bit better than if that wasn't there. So towels for that same reason and applying pressure. Quick note about bandaging. We all want to put bandaging things, in our first aid kits, but it's really challenging to do a bandage appropriately. There's a lot of complications that we see from bandages being too loose, being too tight, and we can actually cause more problems. We can also cause more pain. So, for example, broken nails. Once we control the bleeding with our powder, sometimes bandaging isn't always as great as it should be, because if you think of having like a really bad hangnail on your thumb and then somebody puts a bunch of pressure on it, that's not good. we don't want that. So it's better to just keep them off their foot and not bandage it than to always cover things up. Our tendency is always, we'll just wrap it and cover it up. But even like myself, sometimes I'm like, my wrist hurts today, I did too much typing or something. And I've got an ACE wrap in my first aid kit for whatever reason, and I'll go put it on thinking I'm doing the right thing. And then in 5 minutes, I'm like, this really doesn't feel good. It's uncomfortable. And then I'm unwrapping it and trying it again. It's the same thing with our pets, but they can't talk. So they're not going to be able to tell us, hey, that's not comfortable. And we can also trap an infection, especially with wounds and things, by bandaging. We want air to get to that. We want to be able to rinse them out with soap and water. So we don't want to always cover that stuff up. Okay, just a few more slides. I'm going to go through a couple of common reasons you might need first aid with your pet and how we usually address those. So itch, it's springtime. We're getting a lot of pets that are itchy. They're chewing on their feet. It's allergy season. So outside of those really great effective medications that we utilize a lot for chronic allergies like Apoquel and Cytopoint and stuff, cool compresses can help with itch, wiping their feet down after coming in from outside with a cool, damp washcloth, having some calming shampoo or itch spray. Again, talking to your veterinarian about even having some medicated shampoo on hand that's meant to help reduce itch or infection in your pets can be nice to keep in your first aid kit. There's that, old wives' tale going on all the time on the internet. Oh, you can overbathe your pet. Don't bathe your pet more than every, 4 weeks. You really can't overbathe, especially with itchy pets. Like you think about you or I, if we don't bathe for a week, we get really itchy. And so for a dog that's already prone to itch, bathing is it's very effective. It can really help settle that down temporarily. And again, trying antihistamines is nice, but just get a dose in advance from your veterinarian that's specific to your pet. We're approaching summer now that spring's hit us. So heat stroke, I'm in Kansas. I often see this this time of year more than the summer because people aren't really being aware of how hot it's getting, or they're overdoing it. In the summer, everybody's more aware and they tend to not overdo it. But if you are concerned that your pet is experiencing some heat stroke, they're going to get very weak, maybe have some vomiting, they're going to collapse. That kind of stuff can be a sign of heat stroke. Excessive panting, that can be some early signs, but they can also just do that because it's, too much exercise for them. So put them in a cool shaded area. If you have your thermometer, go ahead and check it. We don't want to delay care for heat stroke. So rather than doing a whole lot of first aid at home, if you have the ability to have them seen right away, especially if they really showed those symptoms that you were concerned about, you took their temperature and it was greater than, even 104, but definitely if they're at 105, 106, then you want to get them seen right away, because no matter what you do at home externally, we've already heated up those internal organs, and often they need more care because we're not going to see the side effects of that heat until several days later. If you can't get veterinary care or you don't have those extreme symptoms, maybe the body temperature didn't get that high or at 103.5 and we're just excessively panting and we're starting to get a little hot, go ahead and put some cool water on the body. But the key is you have to remove it right away, because when you put that water on, the hot body is going to heat up that water and then it's going to trap that heat in and make their body temperature rise. So you put the water on, you take towels and scrapers and you scrape all that water off, put the water on, scrape it off. And it's this constant motion of water on, water off. So you're actually heating up the water, taking it off the body, and then removing the heat. The other thing is alcohol. If you want to have alcohol, like in a spray bottle or something, spraying that on their paw pads can also evaporate quickly. So it's another way to kind of remove heat from the body. And ingestions. So if your pet does get into something toxic, one of the reasons you have your weight on your emergency information sheet is so you have that to give to a professional if you're calling poison control, for example, or you're coming over to AskVet to talk to one of our veterinarians as well. You want to have as much information as you can. So when was it ingested? Try to find out, or at least estimate as best you can, how much was ingested and what are the ingredients, especially the main active ingredient on the product. For topical stuff, there's a lot of over-the-counter flea and tick medications that are accidentally given to cats when they're only labeled for dogs. So we can see some toxicities from that. Blue-green algae, I mentioned, those types of things. You want to rinse and bathe those off the body as quickly as you can. And again, if they do ingest something abnormal, come talk to us at AskVet so we can help you decide if vomiting is going to be helpful or needed. And then just a couple of miscellaneous things to keep in mind. Canned pumpkin is sometimes helpful for diarrhea if you want to add some more fiber to their stool. If you have a diabetic, Caro syrup to have on hand. If you ever get worried that their blood sugar has dropped too low, if they're conscious, you can put some of that on their tongue or have them swallow a little bit to bring their blood sugar back up. Tweezers for splinters and things, or those tick tornadoes to remove ticks off the body, are often handy to have around as well. And if you're going to use this as your evacuation kit, having 3 days of food and water just set aside so you can grab that as you're headed out the door, or even if it's not a disaster preparedness plan for you, if you never know if something's going to happen to you and somebody has to come over and get your pet for you, they can just grab that food and water as they're headed out the door as well. All right, so feel free to reach out to us anytime. That's what we're here for. These are common things we go through with pet owners at AskVet. So we're here to help you decide what truly is an emergency, or maybe some things that you can handle at home. Does anybody have any questions about anything?
Right. So I haven't seen too many questions. I think you covered a lot of probably what people were thinking. The only question that I have thought of for myself is I've seen at stores like the liquid bandage with the bitter like taste to it for wounds and things like that. Is that something that could help with, if they're licking their paws or if it's like a very minor wound that they seem to be licking at constantly? Is that something that is helpful or is it kind of pointless for them?
Yeah, it's a good question. I don't think it's a bad idea to try. In my experience, I see pets lick through that all the time. And then they may actually be promoted to lick more because you've just sprayed something on the area or on their foot or whatnot. So then they're like investigating it. So a lot of topicals tend to do that. So if you're going to do something topical in general, the e-collar is really the best friend because it's going to keep them from licking. But we don't want to just slap an e-collar on and say, deal with your itch. We also or wound, whatever happens, we also need to get that addressed as well. And since you're mentioning it, it brought up another thought of a lot of people like to apply Neosporin to wounds and stuff like that. Neosporin in rare cases can cause some toxicity if ingested, especially by cats. So we want to be careful using that on the body, especially if a pet can lick it off.
That makes sense. That was super helpful. I'm excited to make my first aid kit for my pets. So
Yay, good.
So if anyone else has any questions, drop them in the chat. And if you are here, you're probably a member of the clubhouse already, but if you're not, make sure you go to Facebook and search AskVet Clubhouse. It's a community to support other pet parents and provide, some advice and best practices, tips, tricks, things that other pet parents have found beneficial. And yeah, so there was a question that just came in, cough syrup for dogs. Is it okay?
It's a little loaded question. Yes and no. Dogs cannot have decongestants for sure. So the things with phenylephrine and stuff like that. And then we never want to give a lot of cough syrups and things are also going to have added sweeteners like xylitol, which is toxic to dogs. We need to be careful on the ingredient list. Technically, Robitussin sometimes is okay, but I would talk to your veterinarian to make sure you know the dose for your pet and when to use it.
Perfect. Yeah, let me make sure there's none on Facebook and I think we are good. And yeah, if you are not yet an AskVet member, reach out, we'll help you get started. But it provides you vet-led guidance. You can chat with a vet anytime. And we have a team of care coaches as well, who's there to help with any behavioral issues that might arise. And then we have the clubhouse, which is a free way to, like I said, connect with other pet parents. If you have any other questions after this, and something comes to mind, you think of it, drop it in the Facebook group and we will make sure we get that answered for you. Let's see. Oh, we got one more that popped up. Human grade supplements for dogs, like green-lipped mussel. So it might not be a first aid thing, but is that something that is beneficial?
I'm not sure about that particular product. I'm not sure what that is. I'd have to look that one up. Let's put that one in the clubhouse afterwards and I'll do a little looking at what that might be and can answer that more thoroughly.
Yeah, for sure. I will put that in the clubhouse, or unless Jessica, you want to post it in there as well, you can ask and we will help you out with that question. And in the meantime, like I said, any other questions that pop up, drop them in the clubhouse in the recording and we will make sure we get those answered for you guys. Thank you so much, Dr. Emily. This was amazing. I'm excited. It's going to be super helpful.
Thanks for having me.
Yeah. Have a great day, everybody.
Bye.
Bye.